Assalamualaikum and hi. My name is Ahmad Naufal bin Muhammad Rafi. Today, I want to talk about chronic health problems, particularly in children. So, what is chronic health problems? Chronic health problems are those that last longer, more than 12 months, and are severe enough to create some limitation in usual activities. It usually causes even more emotional distress than temporary problems. So now we are going to discuss about chronic health problems effects on children. So what are the effects? Coping with illness may require coping with pain, undergoing tests, taking drugs, and changing diet as well as lifestyle. A chronic disease often interferes with a child's education because frequent absence from school. The illness as well as side effects from treatment may impair children's ability to learn. It also may affect the inability of child to form a relationship with peers. Illness and hospitalization deprive children of opportunities to play with other children. Besides, adolescents may struggle with their inability to be independent if they need parents and others to help them with many daily needs. Parents and family members may overprotect the child or adolescent, which discourage independence. Hospitalization is a frightening event for children even under best circumstances. Personally, if you ask me, I'm really afraid to be hospitalized. Even when I was a small kid, the doctor asked me to be hospitalized, but I avoid to do so. Alright, next we are going to discuss about chronic health problems effects on parents and other family members. Chronic illness of a child places enormous psychological, financial, emotional, and physical burdens on parents. Sometimes, the parents become closer by working together to overcome these burdens. However, often the burdens can strain the relationship. Parents may feel guilty about the illness, particularly if it is genetic, resulted from complication during pregnancy, or was caused by an accident, such as motor vehicle collision, or a behavior of parents, such as smoking. In addition, medical care can be expensive and can cause the parents to miss work. Sometimes, parent assumes the burden of the care, which can lead to feeling of resentment in the caregiving parent. The emotional distress involved in providing care can also make it difficult to form a deep attachment to an ill child. So next, parents who spend a lot of time with an ill child often have no time to be spent with other children. This may lead to other children feel left out. Okay, today I want to talk about a disease in particular. I want to talk about asthma because I have experienced asthma personally, so I know how it is to be an asthma patient. So, what is asthma? Asthma is a recurring inflammatory lung disorder in which certain stimuli inflame the airway and cause them to temporarily narrow, resulting in difficulty in breathing. Asthma is one of the most common chronic diseases of childhood, affecting more than 6 million children in the US. It occurs more frequently in boys before puberty and in girls after puberty. Asthma has become much more common in recent decades. Most children with asthma are able to participate in normal childhood activities except during flare-ups. Alright, next we are going to discuss about asthma triggers. For unknown reasons, children with asthma respond to certain stimuli or triggers in ways that children with asthma do not. Children with asthma may have certain genes that may make them more susceptible to react to certain triggers. Most children with asthma also have parents and siblings or other relatives with asthma, which is evident that genes are important in asthma. Alright, so now what are the triggers that cause asthma? The first trigger is cause airways to be swollen. Second is stimulate muscle cell in wall of airways to contract. Third is increase mucus production. So each of these responses contributes to a sudden narrowing of the airways. In most children, the airways return to normal between asthma attacks. Repeated stimulation by these chemical substances increases the mucus production in the airways. It causes shedding of the cell lining in the airways and enlarges the mucus cells in the wall of the airways. So now, let's continue with the risk factor of asthma. For the first point, A child with one parent who has asthma has a 25% risk of developing asthma. If both parents have asthma, the risk increases to 50%. Children whose mothers smoke during pregnancy may be more likely to develop asthma. Asthma has also been linked to other factors related to mother, such as young maternal age, poor maternal nutrition, and lack of breastfeeding. Prematurity and low birth weight are also risk factors of asthma. Alright, for the second point, children who are exposed to high concentration of certain allergens such as dust mites or cockroach feces at an early age are more likely to develop asthma. Alright, for the third point, most children who are having asthma attack and 90% children who have been hospitalized for asthma have a viral infection, usually rhinovirus or common cold. Alright, last but not least, diet may be a risk factor. Children who do not consume enough vitamin C and E and omega-3 fatty acid or who are obese may be at risk of asthma. So now let's continue with symptoms of asthma. As the airways narrows in an asthma attack, the child develops difficulty in breathing, chest tightness, and coughing, typically accompanied by wheezing. Wheezing is a high-pitched noise heard when the child breathes out. Not all asthma attacks cause wheezing. Mild asthma, particularly in very young children, may result only in cough. Some older children with mild asthma tend to cough only when exercising or when exposed to cold air. In a severe attack, breathing becomes visibly difficult. Wheezing usually becomes louder, the child breathes faster and with greater effort, and the ribs tense out when the child breathes in. So now, what are the ways to prevent asthma? It is not yet known how to prevent a child with a family history of asthma from developing asthma. However, because there is evidence that children of mothers who smoke during pregnancy are more likely to have asthma, pregnant women should not smoke. So next, asthma flare-ups often can be prevented by avoiding or trying to control whatever triggers a particular child's attacks. Children who have allergies should have the following items kept away from them. For example, feather pillows, pads, and dust. Other triggers such as strong odors, irritating fumes, cold temperature, and high humidity should also be avoided. Alright, for the last point, as exercise is so important for a child's development, doctors usually encourage children to maintain physical activities, exercise, and sports participation, and use an asthma drug immediately before exercising whenever it is needed. Alright, now let's just see what are the treatments to treat asthma. Children who have mild, very infrequent attacks usually take drugs only during an attack. Children who have more frequent or severe attacks also need to take drugs even when they are not in an attack. Different drugs are used depending on the frequency and severity of the attacks. Children with the infrequent attacks that are not very severe usually take a low dose of an inhaled corticosteroid or a leukotriene modifier every day to help prevent attacks. These drugs reduce inflammation by blocking the release of the chemical substance that inflame the airway. Children who cannot use inhaler may receive inhaled drug at home through a mask connected to a nebulizer, a small device that creates a mist of the drug by using compressed air. Inhalers and nebulizer are equally effective at delivering the drugs, but most parents find the inhaler and spacer much more convenient and easy to use.
Is this what it feels like to be lonely? And though I'm not afraid to know it won't be the same without you. And now I'm far from home, and I'm not sure.
So that is all from me. Thank you very much for watching this video. I really hope you roughly understand about chronic health problems. So, see you soon.